Well, we're about halfway through phase one that keeps expanding every day, and now coming up on a weekend that will test that and our social distancing. I'm joined now by Dr. Katie Anderson, part of Upstate University's Incident Command COVID and COVID response teams. Dr. Anderson, thanks so much for joining us. Really appreciate it.
Thanks for having me.
So we are coming up on Memorial Day weekend, and there are more and more things opening. Oneida Shores will be opening, the zoo will be open, and then they will be open after that too. So if you do go to those places, how do you keep yourself, your family, and others safe as well?
We already have a good sense of how to protect ourselves, right? And those things have not changed. So we should wear masks. We should bring a mask because we never know when we're going to end up being in situations where you're crowded with other people. We need to wash our hands. And you want to just be very conscious of what situations might end up where you could get infected. So that means you could go to the zoo. I know that, for example, the zoo is taking good measures and people are providing reservations. They're trying to limit the numbers of people. But you still, even in that setting, need to go and pay attention to where there might be clustering. As you're going in, are people congregating and gathering in groups as you're getting into the zoo? So pay attention to that. And if you start to find yourself in a situation where you feel like it's not safe, take a step back and maybe rethink your plan. That's the same thing as going to Green Lake or other places where it's outdoors. Likely it's safe, it's good to be outside. But if you end up in a situation where there's a lot of people together and you feel like it's closer together than they should be or than you're comfortable with, you need to take a step back and maybe rethink your plan.
So it's probably not advised, but this is Memorial Day weekend, and likely that people may try to have barbecues, maybe with some family, even possibly some friends. What would you tell them besides don't do that?
Besides telling them don't do that, I would remind them of how far we've come in 2 months. And it's clear, and this is to the credit of all of our citizens here and ourselves, that it's been a difficult 2 months, but we've done a good job in slowing the spread of this virus. And because of that, we're now at the point where we can have these discussions about, okay, now we can start thinking about opening up our economy a little bit, slowly, cautiously, starting to see how things go. That means that if this is a priority for us to be able to open our economy a little bit, we cannot simultaneously relax our personal vigilance. This is not the time to be mixing with people more, to be having friends over, to be having barbecues, to see your neighbor, take your mask off and talk to them face to face for a long period. Because if we do that and cases go up, we may have to shut the economy down again. We can't do both at the same time.
So probably as hard as it is, and it's been for a long time, to not have Mother's Day and birthdays and other celebrations. And on Memorial Day, as much as everybody wants to get together, the best idea is to just stay home with your immediate family and honor and celebrate that way, I guess.
That's right. And you can still be outside. You should be outside. You can still talk to your neighbors. Just be careful about it and be safe.
It seems like, kind of dovetailing on that, as we reopen more and more things, the weather's getting nicer, we're starting, it feels like, to maybe let our guard down a little bit. I asked Dr. Thomas about this the other day. Is this virus any different than it was March 16th when we had the first case in Onondaga County?
No, that's the short answer. And we also know, based upon the limited antibody testing that we've done, that our population in the level of immunity is really not that much different than when this first started. So we're still as vulnerable, we're still as susceptible. We're very worried as clinicians and public health practitioners about how people are going to be able to keep up their distancing going into the summer. It's hard, and it's been a hard 2 months, but we're just as vulnerable to this as we were when it started.
This is a question that Christy Casciano and I kind of kick around back and forth with each other a little bit, and obviously we don't know the answer to it. So how does this virus do in water? So for instance, backyard pools that are chlorinated, or even open water like a Green Lakes or Oneida Shores. And I know they don't want you to go in really kind of past that knee deep, or I'm not sure exactly what the footage is, deep water, I guess. But do we have any idea how the virus does in water?
We're still learning a lot about this virus. We know that it can live on some surfaces for hours to possibly even a day. That's hard surfaces. In terms of water, we know that it's not a very stable virus and can be killed easily with things like bleach. So it might be less likely to live in pools. We don't know about lakes and things like that. So I would caution people to keep washing their hands and be highly vigilant about cleaning after you're touching things, including water.
Another thing that, and as far as like pools and Green Lakes and things like that, we don't really know how it does or doesn't interact in there.
Right.
This is another thing we talked to Dr. Thomas about, but as things evolve and change, I keep wanting to ask this. Do we have any better idea how this virus does in warm or hot weather? There's some kind of thought out there as we get into summer that this will get better as the weather warms up and gets nicer out there. Any more idea how it does?
We don't know yet, and we'll just have to see. So we're concerned that going forward, we might have the same level of risk of spread. We don't know that it'll slow down in the summertime like flu and even some of the other coronaviruses do. It might, but what that would also mean, the flip side of that would be we'd be set up for the fall for possibly more transmission.
As usually, like what I do with Dr. Thomas, I always have more questions than we have time for, so we are out of time. We'll have to save the questions for the next time you and I hook up to do this, but I really appreciate your time tonight. Thank you so much.